Dissociative disorders represent a complex category of mental health conditions that fundamentally alter an individual's perception of reality, memory, identity, and consciousness. These disorders are characterized by a disruption or discontinuity in the normal integration of consciousness, memory, identity, emotion, perception, body representation, motor control, and behavior. The experience of dissociation can range from mild detachment to severe fragmentation of the self, creating profound challenges for those who live with these conditions and the professionals who treat them. The foundation of dissociative disorders lies in the mind's natural ability to disconnect from overwhelming experiences as a protective mechanism. When faced with trauma, particularly during childhood, the developing brain may employ dissociation as a survival strategy. This psychological defense mechanism allows individuals to mentally separate themselves from painful or threatening situations, creating a sense of detachment that can help them endure unbearable circumstances. However, when this coping mechanism becomes chronic or severe, it can develop into a full-fledged dissociative disorder that significantly impairs daily functioning and quality of life. The Diagnostic and Statistical Manual of Mental Disorders recognizes several distinct types of dissociative disorders, each with its own unique characteristics and challenges. Dissociative Identity Disorder, formerly known as multiple personality disorder, is perhaps the most well-known and controversial of these conditions. This disorder involves the presence of two or more distinct personality states or identities that alternately control an individual's behavior, accompanied by memory gaps that are too extensive to be explained by ordinary forgetfulness. These alternate identities, often called alters, may have their own names, ages, histories, and characteristics, creating a complex internal system that can be bewildering to both the individual and their loved ones. Dissociative amnesia represents another significant category within dissociative disorders, characterized by an inability to recall important personal information, typically of a traumatic or stressful nature. This memory loss is more extensive than what would be expected from normal forgetfulness and cannot be explained by medical conditions or substance use. The amnesia may be localized to specific events, selective in nature, or generalized to encompass the individual's entire life history. In some cases, individuals may experience dissociative fugue, a subtype of dissociative amnesia, where they suddenly travel away from their home or workplace, unable to remember their past, and sometimes assuming a new identity. Depersonalization-Derealization disorder constitutes the third major category of dissociative disorders, involving persistent or recurrent episodes of depersonalization, derealization, or both. Depersonalization refers to feelings of detachment from oneself, as if observing one's thoughts, feelings, sensations, body, or actions from an outside perspective. Derealization involves feelings of unreality or detachment from one's surroundings, where the external world seems dreamlike, foggy, or visually distorted. These experiences can be profoundly distressing and may significantly impact an individual's ability to function in personal, social, or occupational settings. The development of dissociative disorders is strongly linked to trauma, particularly childhood trauma such as physical, sexual, or emotional abuse, neglect, or witnessing violence. The relationship between trauma and dissociation is complex and multifaceted, involving neurobiological, psychological, and social factors. During traumatic experiences, the brain's normal information processing systems may become overwhelmed, leading to fragmented memories and altered states of consciousness. Repeated trauma can strengthen these dissociative pathways, making them more likely to be triggered by stress or reminders of the original trauma. Research has revealed significant neurobiological differences in individuals with dissociative disorders. Neuroimaging studies have shown alterations in brain structure and function, particularly in areas involved in memory, emotion regulation, and consciousness. The hippocampus, which plays a crucial role in memory formation and retrieval, often shows reduced volume in individuals with dissociative disorders. Additionally, changes in the prefrontal cortex, amygdala, and other brain regions involved in emotional processing and executive function have been documented. These neurobiological findings provide important insights into the underlying mechanisms of dissociation and may inform future treatment approaches. The diagnosis of dissociative disorders requires careful assessment by qualified mental health professionals, as these conditions can be complex and may co-occur with other mental health disorders. The diagnostic process typically involves detailed clinical interviews, standardized assessment tools, and, sometimes, psychological testing. Clinicians must rule out other potential causes of symptoms, including medical conditions, substance use disorders, and other psychiatric conditions that may present with similar features. The presence of amnesia, identity confusion, or detachment experiences must be evaluated in the context of the individual's history and current functioning. Treatment of dissociative disorders typically involves a phased approach that prioritizes safety, stabilization, and gradual processing of traumatic memories. Psychotherapy is the primary treatment modality, with several therapeutic approaches showing effectiveness. Trauma-focused therapies, such as eye movement desensitization and reprocessing and cognitive processing therapy, can help individuals process traumatic memories and reduce dissociative symptoms. Dialectical behavior therapy and other skills-based approaches may be beneficial for developing coping strategies and emotional regulation skills. For individuals with dissociative identity disorder, specialized treatment approaches focus on communication and cooperation between different identity states, with the goal of improved functioning and integration. The course and prognosis of dissociative disorders vary significantly depending on factors such as the severity of symptoms, presence of co-occurring conditions, availability of social support, and access to appropriate treatment. With proper treatment, many individuals with dissociative disorders can experience significant improvement in their symptoms and quality of life. However, recovery is often a long-term process that requires patience, commitment, and ongoing support from mental health professionals, family members, and friends. Living with dissociative disorders presents unique challenges that extend beyond the individual to affect families, relationships, and communities. The unpredictable nature of dissociative symptoms can make it difficult to maintain consistent relationships, employment, and daily routines. Family members and loved ones may struggle to understand the condition and provide appropriate support, highlighting the importance of education and family therapy as components of comprehensive treatment. The stigma surrounding dissociative disorders, particularly dissociative identity disorder, can create additional barriers to treatment and recovery. Misconceptions and sensationalized portrayals in media have contributed to misunderstanding and skepticism about these conditions. Increased awareness, education, and advocacy efforts are essential for reducing stigma and promoting understanding of dissociative disorders as legitimate mental health conditions that require compassionate and evidence-based treatment. Future research in dissociative disorders continues to explore the complex relationships between trauma, neurobiology, and dissociation. Advances in neuroimaging technology, genetic research, and treatment approaches offer hope for improved understanding and more effective interventions. The development of trauma-informed care approaches across healthcare systems reflects growing recognition of the importance of addressing trauma in mental health treatment. As our understanding of dissociative disorders continues to evolve, there is increasing optimism for better outcomes and improved quality of life for individuals living with these challenging conditions.